Continuing on, let's go to pregnancy related body changes to the mother. Pregnancy begins with the implantation of the growing embryo in the uterine lining. A small amount of bleeding is not out of the ordinary for most pregnant women after implantation. The decidua, it is what we call the uterine endometrium after implantation. The placenta, if we can remember, this connects the developing embryo to the uterine wall via the mother's blood supply. And it is made up of the decidua and the outer layers of the embryo. This allows for nutrient uptake, waste disposal, and gas exchange. And next, a refresher, ang cord that links the embryo or the fetus to the uterus, it is known as the umbilical cord. Through pregnancy and delivery, the growing embryo experiences rapid expansion and transformation. There are a variety of symptoms that can indicate pregnancy in most women, and it is common to experience mga nausea, vomiting, right? As well as mga extreme tiredness and exhaustion. Also, mga desires for certain foods that aren't generally sought out before, mga cravings, right? So, when a woman is pregnant, she is at risk for numerous health issues. The first few weeks after conception are the most likely nga time for these symptoms to develop. Not all of these symptoms are present in every woman kay every woman experiences different symptoms during pregnancy month. But when they are all present, a provisional diagnosis gid of pregnancy can be made. So here are the signs. They may include the presence of HCG or the human chorionic gonadotropin in the blood and in the urine. So also the missed menstrual period, implantation bleeding as well. It occurs at the implantation of the embryo at the uterus during the third or fourth week after sang last menstrual period. Next is increased basal body temperature sustained for over mga 2 weeks after ovulation. Also, Chadwick's sign. What is Chadwick's sign? It is the darkening of the cervix, vagina, and vulva. How about the Goodell sign? The Goodell sign is the softening of the vaginal portion of the cervix. And next is Hagar's sign. It is the softening naman niya sang uterus isthmus. Next is ang pigmentation of the linea alba, which we call the linea nigra. It is the darkening of the skin in the midline of the abdomen. This darkening is caused sang hyperpigmentation that results from hormonal changes during pregnancy, and it usually appears around sa mga uh, middle months of the pregnancy. During the first trimester, many women experience breast tenderness or nagasore ang breast. Nipples and areolas, they begin to darken shortly after conception as a result of my increase in hormones during this time. As the pregnancy progresses, mas nagalala or mas nagadamo ang symptoms na naga-progress. For whatever reason, some women may not become aware of their pregnancy until they are already many months along. So some women are unaware that they are pregnant until nga ara na sila gani in the midst of childbirth. Nakibot sila nga abi nila sakit lang siya nila, but then in labor na sila gali, no? Unusually, irregular menstrual cycles, which is common among teenagers, mga certain drugs, no? Nga unrelated sa trying to conceive, hindi siya pills, etc., etc. But yeah, and then those obese women who ignore pregnancy-related weight gain, they are just a few of the possible causes. Nga wala sila kabalo nga, gabusong sila gali. Others may be oblivious ng gid to their own predicament. So wala sila mayo gid naga-observe sa kakatabo sa ilang body. In the first trimester, let's go to the first trimester. We are going to talk about the changes that is happening sa mother, no? Katapos na ta sa pag-discuss sa changes nga nag-occur sa fetus. So, pregnancy's first trimester includes the first 12 weeks of a woman's cycle. Fetal development can be broken down into phases, just as we have discussed. And the chance of miscarriage falls dramatically at the beginning of the fetal period. Fetal development has completed all main organs na and structures such as ang head and brain, and miscarriage and birth defects risks during this time plummet after a woman enters her second trimester of pregnancy. During the second trimester, pregnancy's second trimester is defined sa week 13 and up to 26 or 28. So, as a general rule, most women experience an increase in energy around this time. They gain weight as the symptom of morning sickness na gadula na. Gadula na ang nausea, mga vomiting. So, mas, nag-amat na gain weight ang mother. Second trimester, baby bumps are clearly noticeable at this point. And when it comes to breast development naman, the visible changes begin to take shape around this time, second trimester. Even though the breasts have been developing inside since the beginning of the pregnancy, pero mas obvious siya during this time. Pregnancy can cause the uterus to grow up to 20 times its normal size. And pregnant women can only feel the fetus moving or what we call the quickening sa second trimester. After na natapos na mag-develop into a human shape and nag-start na mag-move ang fetus. In the third trimester, weight growth accounts for the largest weight gain during the entire pregnancy, and during this time, the fetus will be gaining up to 28 grams of weight every day. Hence, nagabugat man ang mother. It is normal for a pregnant woman to be able to raise her stomach up and down as the baby grows and the abdomen drops in preparation for labor and delivery. And due to their increasing stomach or growing stomach, a woman's navel may appear convex or daw naga-pop out. So, pregnancy can be a difficult time for women. Also, most especially with those nga may symptoms such as back pain and impaired bladder control. As a woman's pregnancy progresses, her posture naga-shift. In order to maintain equilibrium, the pelvis tilts and the back arches. Kaya may imbalance na sa distribution sa weight because of this growing baby. So, a poor posture sa woman during the pregnancy, it is caused by the stretching of her abdominal muscles. The muscles in the lower back are less able to contract and maintain appropriate alignment because of this. The stride of a lady who is pregnant is altered. Pregnancy-induced weight gain and postural changes increase the step's length. And nagaka-apektuhan man how the woman walks, no? Paano mag-stand up, paano ang sitting position, etc., etc. As a result, the foot's length and width grow as a result of the increased body weight of pregnancy para masupport niya ang full body weight sang woman, this female. So, fluid retention and also weight gain. Soft tissues, cartilage, and ligaments begin to restructure under the influence of mga increasing hormones and estrogen and mga relaxin. So, may ginatawag nga joint laxity or widening. It can occur at specific skeletal locations such as, for example, sa pubic symphysis sacroiliac. Let's go to the metabolic changes the mother is experiencing during pregnancy. Pregnancy affects protein and carbohydrate metabolism, and insulin resistance in a mother can lead to gestational diabetes. Nutrient metabolism, protein and carbohydrate metabolism are both impacted during pregnancy, and because sa may excess ang protein, half goes to the developing baby and sa placenta. The other half is distributed among various uterine components such as ang contractile protein, breast granular tissue, including sa mga milk gland sa breast, and then sa plasma protein such as albumin and hemoglobin. Fetal development and fat deposition necessitate an increase in nutrition. Kaya kinanglan sang fetus sang nutrition. Steroid hormones, lactogen, and cortisol all play a role in the process of change. Increased gluconeogenesis in the liver also contributes man sa higher maternal glucose level. And it is possible for a woman to develop again gestational diabetes as a result of her insulin resistance. What is gestational diabetes? It is a disease known as gestational diabetes mellitus or GDM. It affects pregnant women who have never been diagnosed with diabetes. Sang wala pa sila uh, even before pregnancy. And especially, nag-occur na siya during the third trimester. It's possible that the condition isn't entirely normal throughout the pregnancy. Pwede man nga may certain imbalance lang, and then mabalik man siya sa normal after pregnancy. And it is possible for a pregnant woman to develop gestational diabetes kay may insulin resistant siya. So because the insulin receptors don't work properly during pregnancy, ang type of diabetes nga ni nga GDM naga-occur. So, possibly owing to pregnancy-related variables such as presence ng human lactogen, it interferes with the insulin or ang mga insulin-sensitive cells. And as a result, ang blood sugar level nagataas. Pregnant women are often identified with gestational diabetes through screenings. So, sa mga prenatal checkups. Glucose levels in blood samples are found to be abnormally high by diagnostic procedures, and as many as 3% to 10% some pregnancies, it is affected with gestational diabetes. This is also depending on the demographic investigated only to those women nga nagpa prenatal checkup. Other obstetric issues, they include preterm birth, low blood sugar, and jaundice. They are more common in children whose mothers have untreated nga gestational diabetes. So may ara nga seizures and stillbirths. It may occur kung hindi maagapan ang gestational diabetes. It is possible to treat gestational diabetes and women who keep their blood sugar levels low kung permi gina-check, and also it can greatly reduce their risk of complications. Let's go to the physiological changes during pregnancy. Pregnancy related physiological changes in the mother are completely normal, of course, and they serve to better accommodate the development of the embryo or the fetus. Pregnancy related changes in women's circulatory, hematologic, metabolic, renal, and respiratory systems are all part of her body's normal adaptation to the growing fetus because kinanglan mag kinanglan mag-adapt sa body ni mother kay not only na lang ang iyang lawas ang ginagaan niya nutrient but also the growing fetus. This is to ensure a healthy fetus. The female body undergoes significant physiological and homeostatic changes throughout pregnancy. Blood sugar, respiration, and cardiac output, they all need to be increased in order for this to work. Uh, we've also mentioned hormonal changes because the endocrine system undergoes changes throughout pregnancy. In pregnancy, the hypothalamic axis is suppressed and the menstrual cycle is also suppressed. That's why stop man ang period. And it is caused when progesterone and estrogen level rise. The placenta's production of estrogen is linked to the health of the developing fetus. Ang HCG or the human chorionic gonadotropin. It is produced by the placenta and it keeps the corpus luteum from producing progesterone. It also rises sa which nagasaka during pregnancy. As progesterone levels rise, ang mga smooth muscle, they become more supple. And during pregnancy, ang pituitary glands ng mother nagadako, resulting in a shift in the anatomy of the mammary gland. Nagalain na ang structure, kay malain na ang function because naga prepare for lactation. Uh, nagi ang mammary gland from ducts nagiging lobular alveolar cells because kinanglan produce sang milk. The production of parathyroid hormone enhances the absorption of calcium into the gut and the kidneys reabsorption of calcium. Cortisol and aldosterone, the adrenal hormones, they also rise. The placenta produces human placental lactogen or HPL. This increases the mother's lipolysis and fatty acid metabolism while saving her blood glucose for the baby. It can also lead to gestational diabetes by reducing the sensitivity of the mother's tissue to insulin. And because of that, may nagkakaroon ng weight changes. And of course, gaining weight during pregnancy is one of the most apparent changes. The expanding uterus, the growth of the fetus, the placenta, and liquid amnion, and the acquisition ng fat and water retention, they all contribute to weight gain. Weight gain can range from 5 pounds or 2.3 kilograms na siya, no? To more than 100 pounds or 45 kilograms. Ang doctor recommended weight increase nag-range siya from 25 pounds or 11 kilograms for women who are already overweight and up to 35 pounds naman or 16 kilograms for women who are already underweight. And this is a recommendation from doctors from the United States. During pregnancy, a woman's breast, they typically increase in size by 1 to 2 cup sizes. But pwede man nga hindi man amo ginaang standard. When nursing, a woman who previously wore a C cup bra may need to upgrade to an F cup or even larger size. Her torso also develops and her bra band size may go up a few sizes. Within 50 to 73 hours after giving birth, the mother's breast will be filled with milk, causing rapid changes in the breast tissue. During lactation, the breast of the woman becomes swollen and achy, as well as lumpy and heavy. It's possible that her breast will grow back in size uh, when after ano pa no, pila ka months pa. And depending on how much an infant nurses or kung pila ang iya ginatiti or ano kadamo, the size of a woman's breast can fluctuate daily. It's not fixed because ang content nga daan sang breast sang mother is milk. So, syempre, nagalain-lain ang size and over longer periods of time as well. Also, uh, last is ang changes nga ga-occur sa circulatory system. So, circulatory changes due to pregnancy, due to increasing aldosterone levels, plasma and blood volume increase by 40 to 50% during pregnancy, resulting in an increase in heart rate. No? May aras ang increase of 15 beats per minute. Stroke volume and cardiac output. During the first trimester, the heart's output increases by nearly half beat. Increased progesterone reduces blood pressure through relaxing smooth muscle and widening the blood vessels as a result of the lower systemic vascular resistance. And after dropping between 12 and 26 weeks, ang diastolic blood pressure nag-return siya to pre-pregnancy levels by 36 weeks. As the uterus grows, it compresses veins, gina-compress ang veins sa uterus and ang mga lymphatic outflow from the lower legs. This will result sa developing sang ginatawag na edema or naga-swelling, nagabanog. Pregnant women are also more susceptible to blood clots man and embolism because their livers are producing more coagulation factors. And following childbirth, women are also vulnerable to blood clots because the left iliac vein is crossed by the right iliac artery. Clots tend to form in the left leg or the left iliac venous system due to increased blood flow through the right iliac artery following delivery. The left iliac vein is put at greater risk for blood clots, which is ma-further worsen siya by lack of postpartum ambulation. So, for cesarean section and undiagnosed or mga untreated underlying thrombophilia, it can both raise the danger nga i-brought sang circulatory changes, most especially ang blood clotting. Alright, so next topics will be discussed in a different video.